Good morning. I was not entirely sure whether I should say good morning. It is still 5 minutes to noon. So first of all, thank you for coming over and joining this discussion on wellness. I'm Sunil, and I work as a general practitioner in UK. And I shall come to talk about my role in a minute. But suffice to say that I used to study here in Kerala. I did my medicine in Kerala. Worked in Perambur Railway Hospital for a couple of years before moving to the UK. So what I will do before I start off the talk is ask you to open the bags that you have, and you will find two cards in there. I think it's green and red, isn't that right? Yeah, so there's a green card and a red card. I would like you to just take it out for me, please. Because we are going to have a small quiz. No special prizes for the answers. Yeah, no special prizes, and it's nothing to do with cricket either. So I'm going to ask you a few questions, and I just want you to raise the red one if it is a no, and the green one if it is a yes. So I hope I get the right answers for the next two questions. Okay. How many of you would like to have a heart attack? So that's good. That's the answer I expected. And how many of you would like to avoid one? So that's the answer I expected. So that's 100% on that. How many of you have spent at least half an hour a day doing exercise? So shall we say 40%? Yeah. Okay. How many of you spend at least an hour doing some form of relaxation techniques, which could be anything of what you choose? So we have some hands coming up there. That's not bad. That's good, about 60% of that. How many of you feel full of life every day? That's very few, so that's less than 10%. Feel stressed on most of the days. Everyone is stress-free? No, the reds are coming up, so that's about 70 to 80%, I think. Get 6 hours of sleep at least every day. So again, that's, I think, less than 50%. Screen time, not on the movies, but actually looking through your emails, your iPhones and mobile devices, etc., etc. So, do you spend more than 2 hours? Can I have a so what I'm seeing is you spend less time or more time? You spend more time. So that's a good 90%, I think. And last set of questions: how many of you have had your blood pressure checked in the last 6 months? That's about 50% of that. Height and weight checked in the last 6 months. So that's good. I would give that to 80%. Have your cholesterol checked in the last 6 months to 1 year? Okay. That's another 70% of that. And either your blood sugars or your HbA1c checked in the last 6 months to a year. So that's again about 50%. I'll come back to the quiz later on in the talk. As I said, I'm a general practitioner, and you might ask me what link do I have with, that's all right, it's fine. What link do I have with corporate wellness? I'll give you at this stage what I actually do. I'm a general practitioner, but a lot of my work is delivering healthcare outside the hospital. We call it primary care in the UK. And I'm directly responsible for delivering healthcare for 15,000 population. That is, my practice does that. And when I say 15,000, that is from the preconception stage of a child, antenatal care, cradle to grave, as we call it. So that's the entire range of services that you would need, including referral to the hospital. So you cannot pitch up to the hospital or wanting to see a neurologist unless you are seen and managed initially by someone like me. Along with a couple of similar practices, or we call them GP practices, I'm responsible for a larger area of 50,000 population, And I'm also on the Health and Wellbeing Board for our area, which is about 500,000 population. And it is through this Health and Wellbeing Board that we do all our healthcare delivery, planning, and policy. So that's roughly my role. And this is generally what we do in primary care. You can see that we do about 7 or 8 times the consultations. That is actually, so we do about 7 or 8 times more work than a hospital would do at about a fifth or sixth of the budget. Yes, we are underfunded, but we still manage to do most of these things. And that's primarily because we manage long-term conditions. That's a bulk of our job. But a bigger portion of our job is health promotion, education, and prevention. And that is where a lot of energy is spent. Yes, there are other things that we do, as you can see on the screen here. But the bulk of the work which people like Shakti, who is the Director of Public Health, tells us to do is implemented by our system. What are the lessons that we can learn in corporate wellness from the NHS? And when I say that, I think you need to understand that though we are talking about corporate wellness here, the principles apply to any form of healthcare, anywhere, whether it's insurance driven, whether it is privately funded or whatever. The principles that I'm going to talk to you about are applicable in all sectors. So if you have to learn from something, there have to be some similarities. So what are the similarities between corporate health and well-being and in what's happening in primary care in the UK? If you look at the 20 to 60-year-old population, which is what I suppose is corporate, the workforce age group, it's very comparable. Their access to healthcare, their educational level, their awareness, all these things are comparable. What is also comparable is the funding structure. Though yesterday I learned that it is not as straightforward as it is in India. In the UK, everything is funded by the government on a tax that is taken off at source. So we do pay quite a bit of tax. And the healthcare, whether it is removing a small toenail or having the most complex of surgeries, is free for the end user. So everything is funded by the government and nothing goes off from the person's pocket at the time of delivery of that healthcare. I was under the impression that the insurance premiums drive healthcare here, but I realized that healthcare, I think the insurance premium is primarily for when you fall ill. So you have to have a condition, and only then are things reimbursed. I mean, but the fact is there is a lot of insurance money as well going into funding healthcare here. So there is their similarity there. And I'll also like to touch upon 2 specific conditions which both Dr. Shakti and Radhashnan mentioned. The first one is mental health, and that is very important because the demographics, the problems that you encounter are very similar. In that it's at a younger working age population. It is often underestimated, and it is probably one of the biggest cause for loss of productivity in the industry. And surprisingly, because not surprisingly, because a lot of the workforce are women, they are also equally affected, if not more. The second one, which I would like to touch upon, I wanted to talk about diabetes, but I thought I'll touch on cardiovascular disease, which includes heart attacks, strokes, all that you can, high blood pressure, all those things. And as you can see, in the UK, it is still a major drain on economic resources. Surprisingly, I was just researching some paper. I mean, I can send you the links later on. But there's been a recent paper just about 8 or 9 months ago on the Indian context of cardiovascular disease, where there is a disproportionate increase in rise of cardiovascular illness, which is, it's heart attacks. You must have heard of people, who are very young having heart attacks, and that is the most worrying trend. The average age of an Indian having a heart attack is much lower than comparable developing nations. So that's a worrying trend, and if you can see the amount, it has increased, and a lot of this happens in the workplace. So this is something really worrying, and therefore, taking all these into consideration, there are three major lessons we can learn from our experience in the UK. The first one is the scope of the problem. We have made a lot of progress in million years, but in the last 50 years, we have really gone downhill because of our lifestyle. And I think this is probably the major determinant of why we are having this discussion today. We always see only this, the tip of the iceberg, but we always miss what is lurking beneath, which is the lifestyle and behavioral patterns that we have adopted all these years. And if you actually go into specific conditions, there are so many things lurking under the surface which don't need medical treatment. It needs lifestyle management. It needs you to change your life around, think differently around managing your conditions, rather than, as Dr. Radhakrishnan said, go straight into the high-end medications as the first step. If you can deal with what lurks underneath the surface, what comes out, the throughput at the surface will be much less. And for everyone all around industry, and even at a personal level, I think this is probably the better option. The headlines are there for you to see, and therefore it's not me making up these things or digging up papers, obscure papers in journals and bringing you the statistics. These are all news items in the last 6 months. I think we are all agree that it is a problem. Is that right? Okay. So we need some strategic thinking around how we can tackle this. And this is where, again, when we develop a corporate wellness agenda or a working plan, we need to think of the strategies rather than, we have all the providers here. Rather than saying, okay, we need to manage it in this particular way, we need to think how we are going to manage it. And the way to think is to look at the iceberg again. Because to reach your lifestyle and behavior level, you need a motivation to change. And I think these can be provided not just at the workplace, it can be provided at the family level, it can be provided through peer interactions. So many things are possible. The other thing is to think of your life not as an illness-free situation, but a healthy healthy life. So we need to move from the treating the condition paradigm to trying to be well. And this is where we have to change our fundamental thinking at a personal level, at an organizational level, and whoever is taking the economic decisions, they need to think on those lines as well. So there is another interesting health economic statistics here. So this is one of my favorite slides in that 80% of the population who are at risk actually consume only 5% of the money that is needed to keep them at that level. So if you imagine, it's about 15 to 20% of the people who are consuming about 95% of the health expenditure. So if you can actually work on the 5% and make it 5 or 7 or 10%, you can actually shift your 80 into 90. So this is where you get your maximum gain. And this may not be just treating everybody with aspirin or statins. It's not that. It may be just as simple as asking them to take up walking half an hour a day. And it may be as simple as that. It is very I don't want to use the word cheap. It is very cost effective. And I think this is where we need to make a change. Because this is what we do in primary care. We look at targeting the people who are yet unwell and making them think about changing their lifestyles. Because that is where you get the best clinical outcomes, and that is where you get your resource effectiveness as well. So as a company, this is what you would be. You're not being, you might not have to spend massive amounts of money to get your wellness into action. It may be a very small budget. In fact, it'll be a fraction of a budget what you spend on 10 people falling ill. I'll give you a small example. This is again another favorite of mine. I'm working on a project in the UK to reduce the risk of falls and fractures. And as a pilot project, we looked at the costings of the cost of treating one hip fracture funds 500 people from or prevents, if you put in the right things like exercise and education, you can fund 500 people from falling and breaking. So you're reducing the risk. So that is the kind of scale we are talking at, and this is where the wellness actually comes into play. It is the bottom of the triangle. You need to focus the bottom of this triangle. And we have examples. The UK. So this is the UK spend in the last 20 to 30 years on managing hypertension. This is just managing high blood pressure. They have spent quite a lot of money, and you can see the results for yourself. In that the mortality from cardiovascular disease has come down. Now, it has started to bottom out here, and that is because there is a limit. There will be people who will fall ill, so we can't take that away. But there will be many people who we will save by putting the right practices in place. The UK government and Shakti's department has realized that this is quite a good thing to do, and they have gone another step ahead in devising. So these are the two local programs we have, which is funded by Shakti's department. It is to keep people active, and that's all that it does. There's no medical treatment, and they are putting in a lot more money to try and do this through various things. So Tai Chi, yoga, all these things come into play, and they have realized investing in these kind of ventures has a much better outcome over a period of time. If you're looking for short-term goals, you may not achieve it. These are medium to long-term goals. So it is changing the behavior, it is changing the way you think about life and work. The same with mental health. So rather than treating a person in crisis, where counseling sessions, medications, in fact, one of the drugs that have been most highly prescribed in the UK is antidepressants. So rather than going down that route, the thinking has now changed. This is something called IAPT, increased access to psychological treatments, and these are all what we already have here. It's not, it is mindfulness, it's yoga, it's so many things that can be done, and that is where the trend is now, to try and avoid a situation where the patient goes into a crisis mode. So the two examples that I gave you before, the solutions that have been worked out and are working well, are going back to the basics, which is improving your lifestyle and catching things before they start to create a problem. And the examples are there. NHS, like the Indian Railways, is one of the biggest employers in UK. And there are individual hospital trusts which have taken up wellness programs. And as you can see, the focus here is on physical activity, healthy food options, health checks, smoking cessation. Then nowhere does it mention that they are providing, coronary care or, things like that. So if the focus is always been on improving general wellness amongst the working, the employees. So it comes in different shapes. There is no one size fits all. So what was useful for this hospital is probably not useful for this one. They have tackled it in a slightly different way, but the principles are same. So here they have looked at work-life balance, flexible working. So it is very individualistic. It is not something that can be read out of a textbook. And I'm quoting a US example purely because there is a long-term study. This is industry, it's a Volvo, they have a subsidiary which markets trucks. And this is a particular study which has gone on for about 14 years. The wellness program has gone on for about 14 years. And you can see the difference and the time that it has taken, but the outcomes are really good. And the key here is they measure what the outcomes, rather than saying we'll implement it and we don't know about if you ask somebody, and we've had occasions when we ask people, they've said, yes, we have it in our place, but we don't know how effective it has been. Because if you need to know something that has to be effective, you have to measure it. So this is one example outside the UK I brought in, and there's another one which many of the people who finance these things would be interested to know, which is called return of investment. So there's a Citibank example where they have found that it is worth the investment. So if you actually look up papers, there's quite good papers run by PricewaterhouseCoopers, which gives us a breakdown of return of investments for different industries. So if it is a IT, the return of investment. So the data and the information is all out there. It's only a question of changing our mindsets and trying to implement it. So how do we implement it? That's the next question. And implementation, the bottom line is you need the involvement of the management. The top management needs to be involved rather than say, let's do it and it ticks the box. It doesn't work that way because it will fizzle out within a year or so. It may grab some headlines in the beginning, but it will fizzle out unless the top management at every level is wedded to that idea. Employee engagement is also equally important because there's no point putting up a cycling track at the workplace when no one wants to cycle. So the ideas usually come from the employee. That doesn't mean every single idea has to be honored. I think you have to take a consensus and see what works. So I think meeting somewhere in the middle, like Dr. Radhakrishnan said, it's not always black and white. Somewhere in middle is probably the right path, but it should involve the employee. And it has to be accessible to them because there's no point having a gymnasium that opens only at 8 o'clock when they finish work at say 5:30. So I think you have to take all those practical things into consideration, which brings me back to the point that it is something very individual to each organization. Having said these two things, I think the other important thing is a partnership, both internal and external, because not all organizations can have all the resources in-house. And so partnership is very important. Now, some industries do have their own occupational health department, but sometimes they are not used, their potential is not used to the maximum. So there are ways of maximizing the potential of their occupational health to feed into the wellness program that you might want to start off. But equally important is having good networking and networks of other providers, which are the external providers, and you have examples of them here. And also sometimes you may need, which I think is already there, a link with hospitals and laboratories, because as I said, as part of all the wellness thing, you may find people who are really ill and they need to be investigated and taken a step further. So I think having those partnerships in place is important. And the next important thing you can have is using the innovations in technology. It doesn't always mean that you have to travel 15 or 20 kilometers to the closest health provider who you have had a contract with to do the health checks. So health checks can be done through various means. And the questions that I asked you earlier on are a way of screening for health. That barely took 5 minutes. So the questions that I asked you in the beginning of the talk is a method of health screening and risk profiling. So it doesn't take that long, and there are various ways of delivering that in a much more efficient way where there is no loss of productivity or time. It can be managed quite easily. So if you are implementing it, there are certain things that have to be there in the system. So these are just the principles. How you do it is entirely up to you, which is where we would come in to help you work it out. Awareness education. So if you remember that iceberg, the last bit where you have the motivational and behavior change, that is where you need to focus on, because nothing will start without awareness. You can get your employees suddenly in the middle of the day to do 20 sit-ups. They wouldn't know what it is for, but you could have ticked a box saying that we introduce exercise during working hours. That's a tick box. The employee is not engaged. It doesn't serve any purpose. So I think awareness education is very important. And sometimes, as I said earlier, targeted interventions are also necessary. Again, the example that I gave you was of health screening, and I have got some of the results here. So if you look at it, so this was just it's not a scientific screening that I did, but I found that less than 10%, around 10, only 10% of you feel full of life, which means there is some degree of stress going on. 50% or less have had their blood pressures checked, blood sugars checked. And if you can see, these are small examples of the tools that we can have, and these can be easily done. And there are there are risk profiling tools which tells us what route a particular person might have to take. We also have risk assessment tools for the entire workforce, which we call it RAG rating, red, amber, green rating. So you can, have a quick screening and you get a red. You might find that your organization is in the red for mental health. When I say mental health, I mean stress, or it may be in a green for mental health, which means you're doing really well or you're doing something really good that is having a positive effect. So there are these are tools which are easily available and easily adaptable to individual companies and industries. And also the lifestyle support. I mean, again, the principles are the same. It may have to be modified in certain ways. So these are not difficult things to do. I think the most difficult part is to want to do it. And I think this is where I hope we will change your mind by this evening. How does it work on the ground? Not very different from what I have said. So the organizational preparedness, all those things you go through quite a few steps of organizing this. But what you need to realize is it's going to be a design which is workable for you rather than something which is available off the shelf and we say, here, implement this. That's not what is going to happen. And as I said, evaluation is probably an important thing. And sometimes, based on your evaluation, you might have to reconfigure what you're doing a bit. And these are things that, as anything else, is likely to happen. So where we can help, I'll give you quick examples. We could do things like gap analysis and find out what your priority areas are. It usually comes from the employees, but you can also find from the HR department. There are quite a few things that can be looked at. And then, look at your resource and see, okay, these are things which you lack. You may need to tap into these kind of, something else. So these are examples how it actually works on the ground. And I think the key to all this is monitoring. I think monitoring needs to be done in a honest way, not it's because if something doesn't work, you have to say that it doesn't work, and if something works, obviously you carry that forward. And as I said earlier, sometimes looking at short term may not be enough. You need to look at medium to long term benefits, because sometimes these things you may not get very much in 1 year. We know for ourselves when we want to change, it does take a while. It takes repeated efforts, so you need to give that a time. But monitoring is probably the most important step here. And as I said, both Shakti and I have been working on this for last year or so. We want to give something back to where we have studied and done most of our medical education from, and that is why we've joined up with this project. Obviously, there is a platform of external wellness providers as well, but the team at Quality Health will be working with you to set these things up for you. There is always the potential, as Shakti mentioned, to collaborate with UK organizations, because we learn both ways. It's not that what we are doing is the gold standard. We may find platinum standards from here. So I think we need to. It is a way to work together. There is no lessons without homework. So I'm going to give you some homework. Is that okay? Not a lot. If you can go back and think about it, are you really wedded to the concept of wellness? Can you think about your priority areas? I mean, you might be able to write it down straight away because you know your organizations inside out. You might be able to write it now, 5 points where you need to focus on, and that in itself will be a starting point for you. So I think doing the homework is as important as just thinking about starting it off. And if there is one slide you want to take back, and if you have to feed back to the higher management, it is to say, can we look at all the people who we call healthy and see if they are really healthy, and do they need any more resources to keep them healthy? And you will find that there will be many in the organization, which is what the data that we have from other industries suggest. But tackling that is not a big problem. I think you need the will and the drive and the motivation to do it, and it's easily possible. And hopefully, if you put that into place, those triangles will shrink. Your healthy population will be really healthy, and your ill people who are ill will be less ill. And I think it was Dr. Radhakrishnan who mentioned that it should come from the person. And I think that is what will happen. I think as employers and captains of the industry, who wouldn't want a very healthy and productive workforce, because we are the engine, the engine house for our economy, and we don't want an engine which runs, as I was telling you, on half battery. So I think this is where the wellness comes into play, because it is a very simple, straightforward concept which needs a lot of commitment in the beginning. I think more than commitment, I think it's a change in thinking that we need to do, and I think that is probably what is going to help us drive forward in our economic development. Thank you.